situations.
But what about in our area? Should we have a similar emergency? Well, for that answer, medical reporter Liz Boner spent the day in local trauma centers. Liz?
Hey guys, good afternoon. You heard today from students and staff at Ohio State that were in hospitals there. Much of their success often depends on how ready the emergency management teams are when multiple people with multiple injuries come into the emergency room. We asked those in and around the campus of the University of Cincinnati today what they do to prepare and what those simply in and around the campus are feeling about what happened at OSU today. So, do you feel like we'd be prepared if something like that happened here?
I do.
The safety aspect, I don't know, we're never truly safe.
In Clifton today, near the University of Cincinnati, we asked students, family members, and friends what they were feeling today about their own health and safety should something similar to what happened at OSU happen on their campus here in Clifton.
We like everything that's been going on in Clifton. Lots of good changes here.
Still feel safe even hearing what happened at OSU?
Yes, I've talked to some friends from OSU and they were concerned, but I feel okay today for sure.
Part of what gives us that feeling of safety, however, is the feeling that those around us in our medical facilities are prepared for a worst case scenario. So we thought we'd stop out here at the University of Cincinnati Medical Center, talk to the people that every day are training should something like this happen in our area.
We have to be ready for that constantly.
Dr. Dustin Calhoun is the Director for Emergency Management here. He says it's not unusual for active mass casualty training like this to be conducted right alongside actual patient care in this emergency room.
So today we are simulating both a trauma and a medical patient.
These are students and staff focused on the two areas Dr. Calhoun says are critical to keeping people alive. If they have multiple patients that need to be transported from a scene, similar to what happened yesterday at OSU, the first is triage, or getting patients to the care center needed.
All of the hospitals work together for preparedness efforts. Some resources we actually do share between hospitals. Mostly it's a communication issue.
The second is simply ramping up medical personnel.
How do we get more doctors in here, more nurses in here if we need to? How do we get more radiation technologists in here? If we have a situation requiring decontamination, how do we get that tent set up? How do we have the personnel and resources we need at a moment's notice?
A moment's notice they hope they never get. Let's say they are ready if they do.
But I don't have any doubt at all that an incident of that scale we would handle in this emergency department without significant difficulty.
Now they do this kind of training at least once a month. They do coordinated field training with other hospitals, often a couple of times a year. Coming up at 5:30, we reach out to another team at Bethesda North. They're actually adding now what to do if a shooter would be on campus at a hospital as well. And they're using pellet guns with the doctors and nurses now, so you would know what that would feel like and know how to respond. Isn't that interesting?
We've been talking about it for years.
Different times.
You have to be ready.
Different times.
Training you
yeah.
hope you never have to use, but glad that they know how to do it.
Absolutely. All right, we'll see you then.
All right.
Thanks, Liz.